Okay, a couple things I want to mention is for week 3, please look in the grade book for your feedback on that registry review sheet that everyone did for fluoro. I attached in the feedback in the grade book, I attached the document that had all of the correct answers. Everyone got full credit for attempting that assignment, but I want you to make sure that you have all the correct answers. So I included the answer sheet because that is a study guide you'll want for the boards. Those are board type of, questions that will be on the board. So you want to make sure that you have a correct copy of that in your little binder for studying for the exam. Okay. The other thing, can you give me a thumbs up if you received the announcement from me today that contained all of the prior PowerPoints from our live session? Okay, good. For some reason, I didn't get a copy of it, so I got a little worried thinking it didn't go out. Okay, great. So those are, that's the material we covered during the live session, which are pertaining to the quizzes. And the midterm this week will be a cumulative midterm on those prior chapters, as well as the urinary system that we're covering tonight. So in that announcement, I did include these urinary system PowerPoints as well. Any questions on any of that material? Okay. All right, so let's get started on the urinary system. It's a brief lecture, just a few pathologies from the urinary that we're gonna cover today. Make sure that you know your basic anatomy of the kidney for your board prep. Okay. And obviously, if they give you a radiograph, make sure you know where your kidneys, ureter, and bladder are. One of the most important parts of the kidney is the nephron. That is the functional unit of the kidney. That question's asked all the time. Okay. Each kidney contains more than 1,000,000 nephrons, and make sure you know what that function is, and it's to filter waste products from the blood, reabsorb water and nutrients. Okay. Supernumerary kidney, where our first pathology, is a rare anomaly in which a small rudimentary third kidney forms. I'm not sure if you can see my mouse, but I'm pointing to the third kidney down here on the patient's right side. It functions normally, but it's prone to infections that may eventually require removal. Okay. Next pathology is ectopic kidney. This is when you have a kidney in an abnormal position, such as in the pelvis. Okay, that's a pretty common one. Pelvis or high near the diaphragm. You see this kidney down here by the bladder on this patient. That's ectopic kidney. Horseshoe kidney. It's a fusion. Kidneys are fused at their lower poles. This is a common fusion anomaly. Oh my God, I can't say that word tonight. Horseshoe fusion, fused at the lower poles. Uterocele. That's a cystic dilation of the distal ureter near its insertion into the bladder. You can see on this radiograph here, cystogram, they are pointing to it. Cystic dilation, the distal ureter. Cystitis, an inflammation of the urinary bladder, and it is the most common nosocomial infection. And that's basically due to the amount of catheterizations that occur in the hospital. Patients tend to get cystitis. Remember, nosocomial infection means hospital acquired. Urinary calculi, hopefully everybody knows this by now. Those are your kidney stones, okay? Kidney stones or it could be asymptomatic until they actually get stuck in the ureter and cause some type of obstruction. And patients, once they move down into the ureter like that, if they're big enough to cause an obstruction, they're going to have a severe amount of pain in their back. If it's too big, most of the time they tell you just have to wait for it to pass. If it's too big and they don't think it's going to pass, then they'll blast it. Best way to prevent kidney stones is drink lots of water. Renal cyst, that's the most common unifocal mass of the kidney, is a renal cyst. You can see that round cyst right here on the radiograph. Polycystic kidney disease. It's an inherited disorder in which multiple cysts of varying sizes cause lobulated enlargement of the kidneys and progressive renal impairment. So it's very obvious here. You have multiple cysts all throughout the whole kidney. And Wilms tumor, nephroblastoma. It's the most common abdominal neoplasm for children, and it arises from embryonic renal tissue. Wilms tumor. All right, that's it for new material for urinary. I figured, you've got the midterm, you're going to be busy with the with studying the past intro, skeletal, respiratory, GI, and then just these few pathology from the urinary will be on there as well. Okay. Any questions for me? This week, the discussion board is once again, yes, that's it. Usually they don't add new material on midterm week, but we had to squeeze in urinary. So I said, well, let me just, focus it to common urinary pathology that we all know. If people have a supernumerary kidney, can they donate to someone else? That's a good question. I don't know. I'm sure they'd have to go through a lot of tests. There's tons of testing to do before you can be a donor. So I think it's, more about all the testing that's required to see if you are a match. Good question, though. So, like I said, discussion board for this week. You only need to choose one of the topics, but all of those topics are going to be on the boards. So make sure you take notes on what your other classmates are posting for the other topics, because IVUs, cystos, voiding cystos, and retrograde urography are all on the boards. And these are all questions that can easily be asked. Okay. I will, by the end of the week, publish the answer sheets for all of these just to make sure, everyone's got the correct answers. But all you need to do is use your bond trigger book to find these answers. Okay. And like I said, you only need to pick one of the topics. So make sure you're reviewing everyone else's notes for the other topics so you can learn from those as well. And the midterms due by Sunday midnight. I believe it's around 80 questions on those prior chapters, focusing on the material that we've covered in the prior quizzes. Okay. Any questions? Okay. Well, this was a short one since it is midterm week and you guys are going to be very busy doing your week's assignment and then, of course, studying for your midterm. Okay. All righty. Have a good night, everyone.